More than a year after the new coronavirus first emerged, there is still no end in sight. Lockdowns, economic turmoil, ever-climbing death tolls, leaving lasting impact on mental health as well. Experts now say that nearly 10 million people will require support for mental health-related issues in the UK itself. The impact on mental health in some countries is as severe as it was during the two world wars. Here's a detailed report.
The United Kingdom is in the midst of its third lockdown. The public are under orders only to leave their homes if absolutely essential. London is deserted. Like much of the world, Britain has endured close to a year of restrictions and lockdowns, and experts say it's having a devastating impact on the mental health of the people.
What we're certainly seeing at this stage is that each time there is a further wave of the virus, each time there are more restrictions, the mental health needs in the population go up. But whereas the virus comes down after each wave, the mental health impacts don't. They accumulate.
Centre for Mental Health has been working with healthcare services in England to try to predict how many people will need support as a result of the pandemic. They say around 10 million people in the UK will need help.
So at the moment, our best estimate, based on the research we can get hold of and the surveys that we've looked at, suggests that around about 10 million people in the UK will need some support for their mental health. That's against a population of 60 million, so it's an awful lot of people.
The pandemic-induced mental trauma has been worse in the low-income households. Lockdowns and restrictions have destroyed livelihoods. Minority communities have also suffered disproportionately.
Nobody's immune to this. Everyone is experiencing the psychological effects. It is a collective trauma, if you like, that's happening to all of us. But certainly we see a number of groups of people that are particularly affected. I think particularly those living on low incomes. We certainly see it in the UK among people from racialised communities, Black and Asian communities in particular, where you have a greater risk from the virus. So of course you therefore have a greater risk to mental health.
Children and young adults are at risk. They have had their education disrupted. Frontline medical staff are also feeling the pressure. Nearly 50% of intensive care staff reported either post-traumatic stress disorder, severe depression or anxiety. Such levels of mental trauma were last observed during the two world wars.
I guess what makes this different is that the incident has been persistent, and we are still in it. We do not know when the end will be. And I guess a similar sort of impact was probably felt by many nations during the Second World War and the First World War, I'm sure. So what we know is actually as communities, in communities actually when things are tough, often don't fall apart. They don't have huge bouts of crisis and panic. Actually, people do tend to pull together more.
With no end to the virus in sight, these figures are unlikely to go down anytime soon. Bureau Report, WION World is One.